first time I did pap smear, I was sweating. Like, I was so nervous, and I thank God for my patient that day. She was so nice because I just could not figure out. I eventually had to call another provider that came and helped me out. Now pap smear is a breeze. Hello, everyone. Good morning. Good morning. It is another week. Welcome to another video. This time I'm gonna try to capture a few days in the week. Happy Thanksgiving if you live in the US of A. I am so grateful to God for his blessings, and it is always a pleasure to give him glory. It's always an honor as far as I'm concerned. I thank God for this platform, for everyone that watches my video. I hope that you are blessed. I hope your family is blessed. And I hope that whatever you may be going through, that God will definitely see you through. Put your trust in him, and he will take care of it. Today is another day. I am now heading into the clinic. It is Thanksgiving week, so we're going to see how this week is going to be. Most times people don't show up a lot because, of course, it's the holiday and they're getting ready to have a good time with friends and family. They're buying things. Some people travel. It's very unpredictable. Sometimes you have a lot of no-shows, and sometimes, surprisingly, people do show. Tomorrow is my half day. I'm going to try to capture some time tomorrow so you guys see how I go. I do clinic in the morning, and then I use the afternoon for my admin time. So let's just flow, okay? Let's just flow and see how this week will go. So now I'm heading into work, and I will see you guys, okay? Au revoir. Bye. Adios. See ya later. Alright guys, so here my day has started. I'm going over my desktop to see if there's any emergency stuff I should look over before I actually begin seeing patients. Then I go ahead and I start seeing patients. I'm here going over someone's PHQ-9, someone that is going through stuff emotionally. So we are just like talking about ways to cope, what to do, and possibly referrals for behavioral health therapy to see if it helps. So let's go. So this is the end of my day today. I have three cases I picked to talk to you guys about today. One, I did a pap smear. The first time I did pap smear, I was sweating. Like, I was so nervous, and I thank God for my patient that day. She was so nice because I just could not figure out. And I eventually had to call another provider that came and helped me out. Now, pap smear is a breeze. Since that day, I don't know that, like, I've seen pap smear before, but when it was actually time for me to do it for the first time by myself, I got nervous. But when she came in, when I called another provider and she came in and she did it, for some reason, something just like it just clicked in my head. It's been a breeze, okay? But I just thank God because my patient was so nice and was so patient for me to do it. So, but anyway, I just thought that was interesting. I should mention, but we all know that pap smear is a screening for cervical cancer. It's done every 3 to 5 years, depending on the age. If it's done with a HPV co-testing, it is every 5 years. If it's done with just screening, the pap screening is every 3 years. The other thing that I did today was skin tag removal. All you do is you prep the area. Of course, you're going to get consent for the patient. You prep the area and you numb the area, and then you can, basically cut the skin tags off, and then you put it in a formalin container for a biopsy. So they're basically going to test the skin tissue. You do have to let the patient know that there's a possibility that it might come back. Anyway, that's it for today. So it is, well, I saw a lot of patients today. But anyway, that's it. I will see you guys tomorrow. Good morning. Okay, what happened to that person? I wonder. So today is my half day. I just got to work, which means I have half day in the clinic. The rest of the day I'm going to be doing paperwork stuff. I already have some 500 form, that's disability form, forms for placard, handicap parking form for some patients. I have a patient that just had knee replacement surgery, and she brought that form so that I can fill out. So today is the day that I do those things. I kind of catch up on my labs and phone notes, refill prescriptions, fill out any forms that a patient may have. Always let them know that forms are filled on Wednesdays. And then once I'm done, I have my assistant call them and let them know that the form is ready to be picked up. If there's any notes that I did not finish yesterday, I also try to finish. So basically today, I should be able to catch up on my desktop stuff. Don't forget to always leave a comment, please share the video. And also, if you notice any interesting case, or if there's something that you want me to talk about, please let me know. If you're a nurse practitioner, what have you been seeing in your clinic? How does your clinic run? Stuff like that. Let's dialogue, okay? Let's bounce off ideas on each other. In nursing school, whether you're in nursing school or you're going for your NP, let me know if there's any interesting case you found at your clinicals, or if there's anything that I'm discussing that you like, or anything you want me to talk about. Okay, we'll see you later. All right, bye. All right, guys, so we have come to the end of today. I think the most interesting case today that I saw was 2 cases of goiter. One of them has not been seen yet by endocrinologists. So this patient has multinodular goiters. This one is really, really big. A goiter is an enlarged thyroid gland, butterfly gland. Most times, goiter is caused by lack of iodine, which we get from salt. It's very rare in the US. Both of these patients today, they are not from here, but so one case is, this patient has a really, really big one that is causing elevated high blood pressure. I'm always struggling to get her blood pressure down. Her blood pressure is usually in the 200s. She doesn't feel anything. Sometimes it goes down when she's a little calm, because sometimes she's also very nervous. So we are working on getting her to see an endocrinologist, but the challenge we also have is that this patient doesn't have insurance. So that's a problem, and that's something we are working on with social services, trying to get her seen. For her, likely she's going to get surgery. Most times goiter don't need intervention if it's not causing any problems, but if it is, then it might have to be removed. The second person actually has removed partially. So this person had partial thyroidectomy and gets yearly ultrasound just to kind of see if there's new ones or kind of things like that. So they were just here for a follow-up to get an order for an ultrasound. One, I had a pre-op. So a pre-op is a pre-operative evaluation where a patient is going for surgery. Depending on what type of surgery they are, that determines what blood work they get. So basically you have to clear the patient. It's like a physical exam that you have to do and get blood work. Most times they do request for EKG, electrocardiogram. So you do that, you clear the patient. Okay, so you go over meds, you go over allergies, you go over medical diagnosis, make sure the person is fit for surgery. The other one that I just picked to talk about today is, it's nothing, extremely like interesting, but something that people should also be aware of whenever you have your patient with a lymphodectomy, a fever, swollen lymph nodes, especially in the neck. Always check if it's a person that is sexually active, and if they're having oral sex, make sure that you get oral swabs to screen them. I've had that happen where you swab the patient for strep, COVID, everything is negative, but the person actually had gonorrhea of the throat. So this person had it 2 weeks ago and it resolved, but because of the fever and they're sexually active, and they say that they had oral sex prior to this. It might not be positive, but just to be on the safe side, I just swapped their throat. See you guys on Friday, where we're gonna close this particular vlog out on Friday. So we'll see what we have on Friday. Until then, au revoir. Good morning. Oh my God, who else feels like it's illegal to work after Thanksgiving? Like, this is post-Thanksgiving day. I hope you had a good Thanksgiving. I did, but I'm so tired. But of course, life goes on. We have to work. For me, I rather work the day after Thanksgiving than work the day after Christmas or after New Year's. So that is why I always find myself working after Thanksgiving, so that I can take off the day after New Year. Of course, today's Friday. I'm working from home, so let's see how today will go. We know that there are cases that you cannot see online, like telehealth, and you have to see them in person. So today, since I'm working from home, I'll also pick 3 cases, and then we'll see the difference between like the type of cases you can see at home versus the case we saw the other day, which was the pre-op. Definitely for sure that you cannot do via telehealth. They have to come in because you gotta listen to their heart sounds, lungs, and actually do a physical assessment, EKG, to clear them. So that's a clear example of something that you cannot do online. Another thing is like something like wound, or skin rash. Sometimes you can, with a skin rash, you can kind of get away with it if it's something that you, based on description, you can try this cream and then come to the clinic. Let's see if it helped, or then I can actually take a look at it. So stuff like that. Let me go unpack my computer. I'm going to find somewhere over there and sit. So let's go unpack computer. We're going to do morning meeting, and then we're going to, run through the day. Okay. So I just finished my morning meeting. So right now I'm actually just gonna go into my schedule and see what I have going on today. I have 9 patients scheduled. We'll be back to let you guys know what cases we saw today, and I'll pick like interesting 3 and talk about. I will see you guys later. So we have come to the end of the day. So I am going to close this vlog here. I finished seeing my patients. The rest of the day is going to be used to go over my paperwork and refill meds for the weekend, since we're going into the weekend. So one of the cases I saw today, one of my patients that was seen by another provider because I did not have any availability for a cough that was really, really, really bad. Okay. And, she had chest x-rays done. Basically, she had bronchitis. So it was just a follow-up to just see if the meds that she was prescribed was working for her, which it was. She was given a short course of inhaler, and steroid and a cough medicate and some cough medication to help her, and that worked. So she is doing better. The other person I saw was one of my patients that had dropped off disability paperwork, and she's a young lady, so I needed to get more information as to why she would need disability. But anyway, her reasons were valid, so I am going to fill out that paperwork for her because she does need it. So when once that's ready, because of course I'm working from home today, so I can bring patients' information home, so it's at the clinic. So I told her that on Monday I'll try to fill it out for her, and we'll give her a call to pick up. The other person I want to mention today was an older lady that I saw. She's in her 70s. She had her thumb. Her thumb was very swollen when I saw her, and I actually thought it was uric acid, right? I thought she had gout because it was really swollen and painful, and she denied any trauma to the thumb. So I was like, I was trying to figure out like what would be causing it. So I drew up, I ordered uric acid level. That came back negative. That was fine. I mean, within normal range. She also had a right hip pain. Of course, she's 70 something, but sometimes they really think something is wrong. So I did x-ray, that came back negative. So this was just a follow-up visit. Anyway, so I rarely do this, but I did give a short, like 3 days course of steroid. Anyway, so that did help, and we are done. See you on the next vlog.